Hi, my name is Neil. I'm the pharmacist in charge today. How may I help you?
Hi Nil. Actually, I'm having a cold and my nose is very much blocked. So I think I need to use a nasal decongestant. I was using it for about a week. Can I have another bottle as please?
Oh, that sounds really uncomfortable and I'm so sorry you've been dealing with this for a week now. Um, I would like to ask you if you if your decongested nose has been going on for a week now.
Yeah, it's actually more than a week now. And I want to know that this nasal decongestant bottle, it helped me at first, but now it's no longer working for me. Can you please explain me why it is not working for me anymore?
The reason why it's not working as much is s- due to something called rebound congestion. And what it basically happens is your nose is basically used to this medication, and using it will no longer be providing you any symptomatic relief. So even if you think that you need this medication, it actually caused your your mucosal line some damage. Mucosal line is inside of your nose and it protects it. But right now, it's a bit irritated due to this medication. So what we want to do is we want to stop using this medication. It's really not the best medication for right now. Could you could I maybe offer you some alternative?
What alternatives are available and how they can be helpful in my condition?
Have you heard anything about saline spray? Have you
Uh,
ever used it?
no, I don't know. Can you please let me know how it will benefit my condition?
So, saline spray is basically salt and water, so it doesn't actually have any medication inside of it. And because of that, it will not keep harming your mucosal barrier and it will let your nose to heal. While it's letting it heal, it will also keep decongesting your nose. So you will like you need the decongestant that you've been using before. So it will just stop you from wanting to use that medication. And also, you can use saline spray as much as you want and as long as you need it. And it's not like decongestant spray because with the decongestant spray, you weren't supposed to use it for a week. But with the saline spray, you can use it as long as you need it for. Um, are we clear?
Yes, I would like to use line spray and see if it helps.
Okay. Well, I would still suggest that if your blocked nose doesn't get any better, please just come back to me so we can just discuss more options. But for now, I think with saline spray, you will recover well. If you have any further questions or anything that you just want to be reminded of, the saline spray will also have a patient leaflet inside of the box, so you can always refer back to it when you're not sure of something.
Okay, I will follow the advice and I'll come back if my blocked nose is not getting better. Thank you for your help, pharmacist.
Okay, thank you too.
Well done. The role play lasts for 4 minutes and 50 seconds, which is fine. So let's just talk about the feedback one by one. So the starting was good. You introduce yourself, and your introduction contained your name, your designation, and you also ask a question saying, "Hello, my name is this. I'm the pharmacist on duty. How can I help you? This is the ideal feedback for community setup. The next part is that you told the patient exactly in layman terms why their blocked nose is not getting better. And then you also explained very nicely that how saline spray is a better alternative. I always say for each task, you have to do three things. First, whenever you start a task, you have to acknowledge what patient said, and then you will explain whatever in the task here, and then at the end, you will ask a question. These three things, and each task is perfectly fulfilled. One thing you can do at the end, like whenever you are dispensing an item, you can add these lines like this. Well, I'll go ahead and dispense your saline spray, and there will be a patient information leaflet inside the box. You can refer to that for more information. And if you don't understand anything, you can always contact the pharmacy. Have a nice day. So that's how you can like end the conversation. And you will also sign posting the patient, and you'll also asking them to come back if they have any questions. So that's a nice stop in my perspective. For the second last task, like when patient is asking you, can you explain me the how saline supply gonna be better for my condition? So you can say that thank you for your question. Now I would like to explain you how saline spray is better alternative, and then you will explain. Like give a little bit of heading. Like what are you going to explain? Then explain, and then at the end you can ask, do you understand why it is like preferable, or why it is more helpful? Or you can ask, do you want to have saline spray now, like that. So overall what you did was very good as well. So there are a few tips which you can use as well, and you're good to go. If you have any question, you can let me know in the comment section. I'll be happy to answer. I'm also sharing my WhatsApp number in the description. You can also check that, and you can reach me out for having such speaking mock sessions. Have a nice day.